metabolic and nutritional diseases of sheep and goat. Sometimes it may go unnoticed, maybe because of ignorance or lack of knowledge. With regard to this sheep and goat, highly vulnerable to these diseases, metabolic as well as nutritional diseases, because of their feeding habit. As we know, they are the grazing habit and the browsing habit. So the nutrients are required to maintain proper health, to support productive activities, and to prevent diseases. And the essential nutrients have specific role because they are highly essential, and an array of chemical elements and molecules that's not sufficiently synthesized by the body of the animal. That means they are not able to support the daily functions. And the requirement is not met by the animal's body, so that we have to give supplement in the feed. And they actually include water, energy, amino acids, and also there are certain minerals which are classified as macro minerals and micro minerals. The calcium, phosphorus, magnesium, potassium, sodium, chloride, and sulfur, we call it as macro elements or macro minerals. And there are certain trace minerals like copper, cobalt, iodine, iron, manganese, selenium, zinc, etc. And also the vitamins are very important. There are fat soluble as well as water soluble vitamins. And among the vitamins, we know that the vitamin C, it is synthesized by most of the mammals. The vitamins K and as well as B complex vitamins, the ruminants, they have a special capacity or ability to synthesize in the rumen as well as in the cell tract because of the bacterial synthesis. So that also we don't much bother about these vitamins. But the thing is that these essential elements and the essential nutrients, they are actually, they are double-edged, because if we are not very careful about the feeding pattern or the dose level in the feed that is given to the animals, sometimes that itself may create problem, because if the intake is significantly below the needs, that will develop as deficiency disease. And if the intake is too much, excess of the requirement, that will become a toxicity condition. So we need to be very careful while administering these supplements. When the animals start showing some sort of clinical signs, we come to know that, okay, the animals are suffering from disease, any kind of disease. But with regard to this nutritional and metabolic diseases, that actually depends upon the nutrient in question. It can be a deficiency or a toxicity condition. So the requirement or demand of that nutrient that in question is, it is very important. And there are many nutrients associated with the specific disease process also, because we cannot pinpoint a specific nutrient, a single one nutrient that is responsible for the development of a disease. There may be some overlapping across the nutrients. So that also we need to consider. And all essential nutrients can cause disease associated with either deficiency or excessive intake. That is the main thing. The metabolic and nutritional diseases, there are too many, but I will just mention a few points regarding the common diseases that we come across. So that include acidosis, hypomagnesemia, hypocalcemia, hypophosphatemia, polyoencephalomalacia, pregnancy toxemia, urolithias. So lactic acidosis may be the most well-known disease among the metabolic disease, also known as lactic acidosis or grain overload. Often excessive intake of grains, that is a cause, and when it is supported by lack of roughage or limited amount of roughage that is given to the animals, then that elicits this condition. And what happens is, when there is not much roughage in the feed, the animal will spend only very less time for chewing, and the production of saliva will be reduced drastically. And this actually, this saliva that provide this bicarbonates and phosphate buffers that help in the digestion. So then when these buffers are not there because of the less production of the saliva, then what happens is material, that is the carbohydrate, they start fermenting, and that leads to rapid fermentation of the starch. When the starch is fermented, there is a production of lactic acid. They are quickly formed in the rumen. High levels of lactic acid is quickly formed in the rumen, and this acid is acid because it can because of this acidity, it can destroy the gut microflora. So all the gut microflora may be killed and that will in turn damage the mucosal lining, that will be leading to drawing in of the body fluid. Rumen content becomes stagnated, that leads to rumen stasis, and because of this body fluid that is taken into the system, there will be diarrhea, and because of this diarrhea, there is also dehydration. Now there is a stage of systemic acidosis when there is abdominal or systemic infection, and that can lead to a number of other problems like laminitis. Because, when there is acidosis, the total perfusion will be damaged. So there will be hyperperfusion, less perfusion, and the blood supply to different areas of the body will be minimized, or it will be reduced drastically. And, the digital area, that will not get sufficient amount of blood. And when there is a small, even a very minimal type of infection can lead to further, serious problems like laminitis. And naturally, when there is all the systems are affected, that leads to death, especially due to overwhelming acidosis or secondary complications. Those animals which have a very high appetite, who can eat more grains, they are actually at more risk also. Large, strong, and young animals, that means who can eat more, they are actually more affected. And a rapid engorgement of the ration due to hunger. Another thing is that if a single animal with the clinical signs of acidosis, there can be other animals that is affected subclinically. So subclinical acidosis may be seen or may be prevalent in the rest of the herd. So we need to take all precautionary measures for saving the other animals also. The clinical signs may be depending upon the severity of the condition. In mild acidosis, there will be watery feces, diarrhea will be there, accompanied by inaptence will be there, and then bubbly diarrhea. The diarrhea will contain the fecal material will have bubbles in that. Depression, dehydration, and then absence of ruminal movements, weak pulse, slow capillary refill, then subnormal temperature, diarrhea, and stomach pain. The colic symptoms may be shown by the animal. And in some cases, it can also lead to laminitis or liver abscess. And within short period of time, this multi-organs will be affected. And you can see kidney failure, and then sometimes fungal ruminitis, other kind of inflammations in all that is affecting all the organs of the body. Everything happens in short period of time. So such conditions, diagnosis, it will not be much difficult in acidosis. The very distension of the rumen will be distended with the pellets and inflammatory fluid. That appearance itself will give you some information regarding the condition of the animal. And we can very well check the pH of the rumen fluid. We know that it is when it reduced to below 5.5, we need to be careful, because it's a sign of acidosis. If the animal dies, we can collect the materials, especially the rumen liquor, for pH checking, pH testing. And please see that once the animal, if it is suspected animal is died, we need to do the collection of this liquor soon after death, because as the time pass on, the pH will again, it will change. The sample collection should be done very soon after the death of the animal. And we can see the gross and histopathological lesions, where you can find the inflammation in reticulum, in the ventral rumen, and also in other parts of the visceral organs like liver, kidney, all will give you some inflammatory reactions or lesions. You have to differentially diagnose these conditions from salmonellosis, enterotoxemia, as well as blot. But it is easy to identify. If it is salmonellosis, you can by cultural identification of this organism, you can find out. You can confirm it as salmonellosis. And this enterotoxemia also, that's clostridial infection will be there, and bloat also you can very well identify from the lesions in the body of the animals. Acidosis is something that is very commonly we come across in the field, and it is very easy to identify from our experience also. So this is one case that we have recently did the postmortem examination. You can see the abomasal fold, the intestine, so the edematous abomasum, and then the inflammatory reactions and the hemorrhagic enteritis. So the treatment and prevention, I'm not much well versed with this treatment and prevention, but I will just give you some very important points. And while you feed the animal with the roughage, give some importance for the fiber length. It is said that roughage of an adequate fiber length of 2.5 centimeter with adequate fluid intake that will give your animal some healthy functioning of the rumen. Take care for regularly feeding of palatable roughages of an adequate fiber length. That will really help the mastication, that will stimulate the mastication and saliva production. So that can, to some extent, reduce the incidence of acidosis. And for prevention also, you can, while you're giving the carbohydrate diets, you just give, increase the amount of in gradual stage by stage over a period of 2 or 3 weeks. When you give it extensively or excessively, closely monitor the animal for the early signs of acidosis, like reduced appetite, reduced rumen movement, or sloppy feces. And never give a chance to gorge on this concentrate diet. So you should be very careful while giving this concentrate. And then give importance for feed additives like soda bicarb and then bentonite, ionophos like additives. They are also helpful, especially during the first few weeks of grain introduction. So when you are initially giving the grain, you can also give some amount of feed additives according to the requirement. Then another condition is pregnancy toxemia or ketosis. That is also, again, as the term indicates, it is causing toxemia, especially in pregnant animals. It is also known as lactational ketosis, fatty liver disease, or lambing paralysis, or twin lamb disease. The causes attributed are whenever you find there is undernutrition in the flock, or when there is a sudden stress to the animals, and rarely multiple fetuses, having more than 2 fetuses, then such conditions will predispose these animals to this condition. And initial signs in pregnancy toxemia, appetite is poor or absent, and they start reducing consumption of grain first. Sometimes the affected ones they lag behind the herd. They'll be slightly inactive, and they become depressed and skinny. The essential nutrient, that is the glucose metabolism, it is playing a role in this condition. We know that the principal source of energy to the fetus, it is glucose, and utilization by the fetus, it is actually happening at the detriment of the mother. It is from the mother that is this the required glucose, it is given to the fetus. And when there is more than 60% of the fetal growth, especially during the last 40 days of pregnancy, there is a tremendous fetal growth, and requirement is also very, very high, especially during the last 90 terminal stages of pregnancy, means that almost 90% of the fetal growth that take place at that time. And then the blood sugar level decreases as the pregnancy progresses, and that leads to a condition of hypoglycemia. And from 35 to 45 milligram per deciliter, it will reduce 20 to 25 milligram per deciliter, especially in the late pregnancy. And when it comes down to as much as 18 milligram per deciliter, then the toxicity or the toxemia condition may start expression and manifestation. And the severity of hypoglycemia is directly proportional to the degree of undernourishment. So if your animal is not at all nourished well, means the condition of hypoglycemia will be very drastic. And also there will be, add to that, if you are not giving nutrients, and then the increased requirements of the fetus or the multiple fetuses, that will really aggravate the condition. Signs in this pregnancy toxemia, the animal show different types of clinical symptoms like chewing, teeth grinding, or vigorous licking movements. Then scoring will be there. Then twitching of the ears and muscles, then eyelid spasm, depression, blindness. Because of blindness, they may run to objects hit to the objects, animals may not show response to their environment. They will, there'll be something like they forget about the environment, and dullness, depression, they become severe. They are reluctant to move, and incoordination will be there, sternal recumbency, and then lateral recumbency. And later on, in the later stages, they become comatose and eventually die. And sometimes we may find also some intermittent periods of hypersensitivity, especially maybe because of the ketone-induced magnesium concentrations. But actually the reason for this development of these clinical symptoms, it's actually a mixture of conditions like production, hyperproduction, fetal demands, undernourishment, and then glucose deficiency. So when there is deficiency of this glucose, what happens is, as we know, there is the utilization of body fat as the energy source, and this fat cannot cross the placenta. So the fetus again still is not getting the energy, sufficient energy. So what happens is the amino acids are made into glucose, and then again what we call as gluconeogenesis happens, and then breakdown of the fat, and then there is some more fatty acids. Resultant fatty acids will be increasing. So there is excessive ketone bodies, acetone, acetoacetate, and beta hydroxybutyrate. So the liver is in a capacity, that means it's a condition that it cannot manage this the inflow of the different types of ketone bodies and the fat that is infiltrated into that. So what happens is the liver capacity to metabolize this will reduce, and that will lead to fatty liver disease, and which you will see only when you do the postmortem examination. You can see in such cases enlarged pale yellow to orange colored liver. So that is how it happens. Ultimately, everything falls on the liver, and then the liver become damaged completely. So as the level of ketosis increases, there is a bicarbonate level in the blood, and that decreases, and then there is also acidosis, and that actually then the animal will become comatose. And later stages, what happens is to aggravate the conditions, to make the conditions very worse, the water consumption of the animal decreases. So naturally urine output will decrease, then that will end up in renal dysfunction. And then blood sugar increases severely, that will lead to hyperglycemia, and then the adrenal gland will respond to stress, and then again that is again causing problems. And severe cases, the animal will show because of all these metabolic functions or activities or misfunction or dysfunctions, there will be neurological signs shown by the animal. And how we can prevent this condition? It is all because of the nutrients, that we are not giving much attention to the nutrient level. The level of nutrition should be increasing as pregnancy progresses. The demands, the fetal demands increases. So as per that, to accommodate that increasing demand, we have to increase our nutrient supply also. How we can check that whether we are giving sufficient nutrients? That means at different stages of pregnancy, we need to check the body weight of the animal. So should be gaining body weight during pregnancy. That means a gradual increase in the weight, that is mandatory. If we are not sufficiently giving the nutrients, and there is a undernourishment, and this undernourishment even may be tolerated when there is a gradual onset of undernourishment. That will not lead to a condition of toxemia. So if the feed intake was not increased during pregnancy, and if we are not at all attending to the requirement or need of the animal as per the stages of increase in stages of pregnancy, or sometimes if the animal is starved for several days, then it can cause toxemia, pregnancy toxemia. Add to that, there are certain predisposing factors or complementary factors like weather changes or any other infection or transport stress and the inappetence. So all will increase the severity of the conditions of this pregnancy toxemia. So we need to be very careful when the doe or the animal is pregnant. So you have to take additional care and attention for the pregnant animal. The clinical signs, I have explained so many clinical signs. So all these clinical signs you can also see in other conditions like polyencephalomalacia, hypocalcemia, toxic mastitis. That means if the animal is near or after kidding and in grain overload, as also listeriosis and lead poisoning. That means the nervous signs you may confuse with these conditions like lead poisoning, listeriosis, or polyencephalon Malaysia. So we have to rule out all these conditions. Listeriosis, it is easy to diagnose. We can identify the cultural sensitivity of this listeria organism. Then lead poisoning also from history, and also by checking the tissue, we can come to some conclusion about whether there is any poisoning of the heavy metals like that. Then another condition, it is very common again, especially in late pregnancy in animals. That is a condition, we call it as hypocalcemia, periparturient hypocalcemia or milk fever. So especially when the animal is in late pregnancy and there is calcium loss, because the developing fetus need more calcium for the bone mineralization. So especially the demand is more when there is more than two, when there is multi-fetuses. So the animal will start, the affected animal will start showing the kind of ataxia. It's not able to walk properly. The zigzag movement will be there, nervousness will be there, and sometimes they'll show some hyperactive attitude, hyper irritable, and muscle twitching of the lips, eyelids, and ears, trembling, twitching of muscles, convulsions, and they become recumbent. Quickly become sternly recumbent, and then later on they become laterally recumbent. And then you can see the characteristic posture of that animal, head turned back to the flank. So that is a very typical in case of milk fever or periparturient hypocalcemia. And that is the severe condition of hypocalcemia. But you may find sometimes less severe cases with lethargy. The animal is not very active. It's not very, it's not taking feed normally. Pure, the appetite will reduce. Poor appetite will be there. Poor milk production will be there, and that may be a sign of subclinical hypocalcemia. So we have to be careful when you see such symptoms in the flock. We need to give more attention. Happens in dairy cow on or soon after calving. It is especially in high-yielding animals, high-yielding cows. And in sheep, it is said that it's during late pregnancy, there is a chance of developing hypocalcemia, especially for because of this, for the fact of bone mineralization of the fetuses. But in case of goat, we see all these conditions. It can be sooner after calving, kidding or pregnancy time, or even during the peak lactation. So in goat, you can see all three conditions. And I have already mentioned about subclinical hypocalcemia, that is, the animal is not very active. And other clinical symptoms in hypocalcemia, stop eating, and the ears and skin are cold to touch. You can very well feel that subnormal temperature, and body temperature is slightly elevated, but then decline to subnormal in a short period of time. And the pupils will be dilated, and they respond very slowly to a flashlight. You can, if you closely examine the animal, you can very well notice this fact. And the heart will be very hard to hear. You can feel the pulse very weak. The weak pulse can be observed, and the animal will become nervous. Ataxia will be there, hyperactivity will be there, hyperirritable, all I have mentioned already, and twitching of the muscle, lips and eyelids, trembling, twitching of the muscles, and the hind legs will be splayed out behind the body, and sometimes the animal may show conversion before that. The tunnel recumbency, sternal to lateral recumbency. And then once the animal is lying in that posture, you can see that sometimes the aspiration, you may find sometimes, you may suspect aspiration pneumonia sometimes, because of the posture and specific appearance of this animal, or the lying down of the animal, there will be regurgitation of the contents, rumen contents, and that may cause aspiration. Occasionally, there is sudden death. The animal will be found dead in the morning, and the duration of the disease may be a few hours to a couple of days. So that means sudden death in some cases within few hours of this. disease. So here you can see how the animal is lying down, and if the death happens in such cases, we have to estimate the serum calcium level. So if we know that it is 8 to 12 milligram per deciliter, from that it comes down to less than 6 milligram per deciliter. And if we are not able to get the serum, then sometimes it is also advised to take the the fluid from the vitreous humor. But take care, if you are going to collect the fluid from the eye, you have to do it very soon after the death. Otherwise, again, that will give you a misdiagnosis. So you can even test the eye fluid soon after death for the estimation of this calcium. So we have to be very careful while giving the intravenous calcium boroglofenone solution as infusions. And you can follow this IV injection by subcutaneous injections of calcium solutions, or oral supplements can be given. And less severe cases, you can give just subcutaneous solutions of calcium will help you. And the doe usually starts to shiver and brighten up that time the treatment is finished. That will give you some excitement. But if it is not correctly diagnosed, that means if you are giving to an animal that is not actually having this hypocalcemia, maybe sometimes the condition may be complicated by another diseases. In those cases, your treatment may not give the exciting result. So you have to be very careful while giving this intravenous calcium treatment. Intravenous treatment only with the strong clinical evidence of the disease it is suggested. And calcium can easily cause death of the animal if given intravenously to an animal with a normal calcium level. So please check. You have to double confirm the calcium level before you give that intravenous calcium. And following intravenous or subcutaneous injection, dietary intake of calcium should be heightened. It can be increased by giving some alfalfa hay or calcium-based mineral supplements. That will help the animal to recover fast. For prevention, we can maintain appropriate dietary calcium and phosphorus content especially in the late pregnancy. And that is especially to support, that will support the fetal bone development, and don't give much, not to give excess. So you have to close monitor the dietary potassium level as well as dietary magnesium level, because all they are correlated. Once the animal is into lactation, the dietary calcium and phosphorus content will be increased to levels to support milk production capacity. You have to take care of the need of the animal. That means need of the fetal demands, and also to meet the lactation need. Alfalfa hay, it is considered as a good supplement, and you have to take care while giving other cereal crop forages like wheat or oat hay, because they are very low in calcium content. And these conditions, as I have already mentioned, you may confuse this with the pregnancy toxemia and ketosis. The clinical symptoms may be like something related to or similar to pregnancy toxemia and ketosis. That means we have to differentiate diagnosis conditions from all these diseases like acidosis or grain overload, lead poisoning, listeriosis, toxic mastitis, polyencephalomalacia. All are having similar clinical symptoms. So we need to be sort it out, rule out all these conditions. Another condition usually come across in field, it is lactation tetany or grass tetany or hypomagnesemia. So this occurs in early lactation and results in a life-threatening disease process characterized by severe tetanic muscle spasm. So here the condition is much more severe, and it's life-threatening sometimes. There will be severe tetanic muscle spasm, and the affected animals initially show ataxia, stiffness, and hyperexcitability. And in those conditions, we should think of hypomagnesemic tetany or grass tetany. So what happens here is, it is with regard to lactation, generally occur during early lactation sometimes. And all the clinical syndromes with related to this condition, that will show low magnesium. That means we take all other clinical conditions also may show, will give you a low magnesium level. And you have to specifically see the status of the animals. It is the lactating dose upon spring pasture means they are grazing on spring pasture, or the growing kids which are kept on a milk replacer. So if these group of animals are showing this particular, excitability, hyperexcitability, and nervous symptoms like stiffness, then you have to give special attention. And sometimes, the combination of low intake of this magnesium coupled with greater losses of this element can aggravate the condition. So the real cause of this hypomagnesemia, that is the mineral interactions, that is the feeding of the animal, that is when there is some mineral interaction that in the feed that is given to the animal. So magnesium is inefficiently absorbed from the rumen. That is a fact. And when there is dietary levels of potassium and excessive calcium, that will interfere with magnesium absorption. And potassium is especially of concern related to magnesium absorption. Magnesium also plays a role in maintenance of blood calcium concentration. So we need to be with double care, to give double attention, because hypomagnesemia can induce even hypocalcemia. And the type of feed that may cause the feed that causes the disease, that also matter very much, because there is a difference in the magnesium content in the grasses and legumes. Grasses contain less magnesium than these legumes. And especially when these does grow rapidly in cooler conditions, that is less spring pasture, they are highly palatable, and they are have high taste, but magnesium availability in that feed content, it is greatly reduced. So the thing is that goats have this particular species of animal have very less ability to manage the blood magnesium concentrations if dietary levels of absorptions are depressed. That means the animal has a less capacity to adjust to the conditions. So that is why they are more prone to this hypomagnesemia condition. So the clinical signs, as we have already discussed it, like in other conditions, as like we have seen, it's a life-threatening disease, and in early lactation, we may find severe tetanic muscle spasm, severe tetanic muscle spasm will be there, ataxia, stiffness, and hyperexcitability. Then animal become recumbent, paddling, and all muscles will be overstimulated. So that is very peculiarity of this condition, and there will be extreme leg stiffness and muscle spasm, and you can very well differentiate it from the paralytic muscle weakness of the hypocalcemia. And convulsion may be there. Convulsion may be triggered by any stimuli. When there's any predator attack or anything that comes on the way of the animal, that will give some result that will result in the convulsions. Then severe weather changes that may aggravate the condition. Then transportation or any kind of other stresses will aggravate the conditions. So in all these conditions, the one common thing that you can note down, it's a low magnesium level. So we have to treat the animal as an emergency situation. The treatment, it is combined magnesium and calcium solution. Still, I think MyFX is popular. Combined magnesium and calcium solution is necessary as IV administration, followed by magnesium sulfate solution. Subcutaneous injections also it's advised. Oral magnesium supplementation is also done. You can see high rapid response to the intravenous therapy, but it is short-lived. You can repeat the treatments that is necessary, and also support it with the subcutaneous and oral supplements to prevent the relapses. So how we can prevent this condition? We have to be a little more careful when the animal becomes pregnant. From late pregnancy through early lactation, we have to give dietary supplementation. It needs to be increased to account for the high dietary potassium, and dietary magnesium should not exceed 0.4% of the dry matter. You have to take care. You should not give excess magnesium as well. So there should be a ratio of dietary calcium magnesium ratio, that means 4:1, that is optimum. And magnesium supplemented in mineral mixes, but it is unpalatable. Magnesium, we can give it with the other mineral mixes, but to make it palatable, it is mixed with the 1 part of magnesium oxide and 1 part trace mineral salt, and add to that 1 part soybean meal or other palatable feed, so that the animal will be easily taking that feed. That will help you for the effective management or maintaining good magnesium intake and prevent the problems of conditions like hypomagnesemia. It's very common in sheep and goat. Urolithiasis, urinary calculi or kidney, bladder or kidney stone or bladder stone, or it's also known as water belly. So it's a metabolic disease of bugs and withers. It's a male-oriented disease. It's gender-biased disease, more commonly seen in bugs and withers, and it's characterized by it is urolithiasis. I mean stones. And what happens to stones? There is formation of concretions within the urinary tract. And what will these concretions will do? Naturally, they will obstruct the outflow of urine. So urine outflow will be impeded. So there will be obstruction. And the contributing factor is that the male urethra, especially it is narrow and long, and blocks will be there. You can see it is narrow and long, and you can see the blocks at specific point locations like urethral process or the sigmoid flexure. So this is to show you that the sigmoid flexure, where actually this the stones will cause the obstruction in the sigmoid flexure as well as the urethral process. And if it is in the urethral process, I think it is very easy to remove also. So what is actually the causes of this condition, or the stones, development of stones in the bladder or the kidney? High concentrate diet, that is again another problem. But this time, the concentrate diet, when it contains excessive phosphorus. So high phosphorus intake can lead to this condition. And magnesium and ammonium sulfophosphate precipitate to form concretion of or calculi. So especially the phosphate, that is magnesium as well as ammonium phosphate, have a tendency to precipitate. And they form this concretion of calculi of about sand-like particles may be there sometimes, or it may become as big as 5 to 10 millimeters in size. And the most common type of these stones that fall under calcium phosphate and it's too white. We know that it's magnesium ammonium phosphates. That is these two white crystals. And other causes that is attributed, we said high phosphorus, less calcium diet. That is, and then calculi often have the appearance of the sandy particles will be there. And when the urine is alkaline, there is high potassium intake in forages. So that also again aggravate the predisposed for the formation of this condition. And another fact is vitamin A deficiency. So you know that vitamin A it is very essential for the maintenance of the epithelial tissue. So the integrity of the epithelium is maintained by vitamin A. So when this vitamin is deficient, there is some changes or damage or the degeneration of the lining cells of the urethra, and there will be exfoliation. When there is degeneration, they die, then they exfoliate in the lumen, and that actually form a nidus, a center, a focus for the formation of the crystals. So that is again another predisposing factor. And this happens most frequently during winter or periods of very warm weather. That is the weather also predisposed by, because in these conditions, the animal may consume less amount of water. So when the water consumption is reduced, that again become another supplementing factor or predisposing factor for the development of this condition of urolithiasis. So the clinical signs that is actually when the animal is having the stones, the bladder or the kidney, and that may be there for some time, but the animal may not show symptoms until there is obstruction. So when there is partial or complete obstruction of the urethra, then the clinical symptoms start. The animal will be showing uneasiness, frequent attempt to urinate, and straining. It is very common condition seen in animals, especially this male bugs. The animal may also have constipation and frequent dribbling of small amount of urine, which may be blood tinged sometimes, and crystal deposits may be collecting on the prepucial hair. So you can, when you closely examine the animal, you can see the prepucial hair may have some crystal deposits. And this is a bladder containing stones. Because this pain and uneasiness, they refuse to take feed. food will not be taken, and they isolate from the group and they kick at the abdomen. Poor animal, they'll be having pain and they'll kick at the abdomen. Because of this, all these actions, sometimes, the bladder may rupture and the abdomen may enlarge sometimes. So the urethra rupture, lower abdominal wall become thickened. And when there is a rupture of this bladder or urethra, that time the animal may show some temporary improvement. That means that pain is relieved. But as time progresses, the animal become more depressed, and that when there is a rupture, there will be peritonitis and all sorts of problems, and eventually the animal will die. So it is a very severe condition as far as these animals are concerned. So that is just to show you the calcium carbonate uroliths that is taken. It is from a 4.6-year-old neutered male goat. So you see how beautiful are these stones with the concretions. You can see these crystals on the preputial hair also. So the treatment of this condition, it is that there is some obstruction in the urethra. So we need to remove that obstruction. That means often surgery is mandatory. If the blockage is at the urethral process, it is very easy. It's not very easy, but it can be snipped off by surgery. A simple surgery will do. And you can also give some oral ammonium chloride or anionic salt products that to dissolve the stones. But if the blockage is higher, that means the location is very higher, then it's not easy to snip it off, but it may warrant a perineal ureterostomy. And it's a salvage procedure as the whole heals up in a week. It takes some time, a week's time, and it's not a suitable option for breeding buck, because once it is it's undergone surgery, means that sometimes the animal may not be able to breed later. So it is done in very rarely in breeding cases. But there are sometimes people also they resort to expensive surgery where they have to open surgery, that is abdomen is open, bladder is open, and then catheter is drawn from the bladder into the urethra, and the stones are flushed down to the penis. So that sometimes, rarely it is tried that way also. If it is successful, that means you can remove all the stones. You can use that breed the buck again for breeding, but it is not that much easy. But it is the recovery will be a little bit prolonged. So prevention is here. It is much easy for you to get rid of this this malady. But this is a condition better prevented than treated. So treatment is it is rather painful as well as time consuming, and it is rather tricky. So you can prevent this condition by properly giving the diet. The diet should have a calcium phosphorus ratio 1.5 to 2 to 1:1. That means you should regulate the phosphorus calcium phosphorus intake. And salt should be included at 1% of total dry matter intake, and plenty of fresh, palatable water should always be available. This is a very easy thing that you can confirm in your farm, giving plenty of water, palatable fresh water. And you avoid diets high in potassium. That also giving some mineral imbalance. And vitamin A should be there in the feed. It should be optimum. You can give some green fodder also. And ammonium chloride in the ration at 0.5% of dry matter intake, sometimes that may help the animal, especially for kids on cream grains. And then another thing is that you must avoid other conditions like coccidiosis, pneumonia. All these conditions can compel the animal to reduce the water intake. So any condition that will reduce the water consumption, that should be curtailed. Low milk fat syndrome. It's a low milk fat syndrome, means as the name indicates, the fat content will be below the standards for a particular breed of animal, especially in milk breeds. It is very important. For breeds where milk fat is 4 to 5%, and if they have only milk fat means around 3%, that means a low milk fat syndrome. It is seen in dairy cow production when your diet is low in fiber and high in grain. Again, that is a problem. And also take care, the diet with higher polyunsaturated fat can also cause the same problem. So the fatty acid, the fat content also should be optimum. You should not give some high polyunsaturated fatty acids. Some compound like conjugated linoleic acid. So it is found that these compounds, biohydrogenation product of polyunsaturated fatty acids, and that is produced in the rumen. This compound, known as class ELA, conjugated linoleic acid, they suppress the fat synthesis. That is a new finding. They can suppress the fat synthesis in the mammary gland. So if the animal is producing this in high quantity, that means the fat content will be reduced. So the preventing methods, we can prevent this formation of, it is said that this conjugated linoleic acid, it can be reduced, or we can find some way to prevent this formation of this clump. So for that, so we have to give high fiber diet, and high vegetable fat will also increase that production of this trans 10 CLA, that is conjugated linoleic acid. And we should focus our practices, that is to have an appropriate fiber to this concentrate ratio. And we can also minimize additional vegetable fat supplementation by giving, we have to minimize additional vegetable fat supplementation like soybean, whole cotton, seed, etc. So while giving these, especially this conventional feed items, we have to think of the fat content in that, because the latest finding is that this fat compound that is produced in the this certain linoleic acid compounds in the rumen can suppress the milk fat. We can control that low milk fat syndrome by regulating the fat content in the feed, as well as by giving high fiber content in the feed. Then another condition, it is white muscle disease, cystic lamb disease. It's a condition of it's a mixed response of vitamins and minerals that is given in the feed. So that will lead to nutritional myodegeneration. There will be acute muscle necrosis, and we call it as white muscle disease. The culprit, it is selenium deficiency and vitamin E deficiency. And it is more commonly seen in young, fast-growing kids. So what is seen is they show severe pain, they're reluctant to move, but they have the tendency to eat. And it is sometimes end up as sudden death when the cardiac muscle is affected. So it is affecting the muscle. So it causes muscle necrosis. So if the muscle happen to be in the heart, cardiac muscle is affected, means that will lead to sudden death. So the causes attributed are the soil. The soil deficient in selenium, resulting in low selenium content in the forage. And then it is an antioxidant like vitamin E. So when this antioxidant is not there, means some oxidative radicals will happen. They will cause the muscle degeneration. Just to show you the muscle degeneration, muscle necrosis. So it is a cardiac muscle necrosis. You can see the pale white areas in the myocardium, and this is how a white muscle in affected animal and the normal muscle. So the animal will become necrosed, and then the color will become white. That is white muscle disease. Treatment and prevention, it is in acute cases. We can give acute injections of selenium with vitamin E, and pregnant, especially pregnant does are injected with 2 to 4, they are injected 2 to 4 weeks before kidding. And because we know that it is the newborn that are affected, so you can give this injection to the pregnant dose 2 to 4 weeks prior to kidding. And the kid should be re-injected again at 1 month of age if not given in the feed. If you are not providing supplements, then you have to give the injection. And you can give the trace mineral salts with a maximum of 90 parts per million, and it can be added also to the mix. So another important condition, it is polyencephalomalacia, thiamine deficiency. It is very common. The once the animal is affected, means it is very difficult to get back that animal to normal. So polioencephalomalacia, it is thiamine deficiency. It is characterized by necrosis of the cerebral cortex. The brain cortex is necrosis. So it's not affecting any muscle. So it is directly affecting the brain, and that causes cortical necrosis of the cerebrum. And young animals on high grain diets are affected more often. Young animals on high grain diets, then older animals and pastured animals may be occasionally involved. So the thrust should be given to young animals when you are giving high grain diet. The appetite will be lost. The animal does not drink. Temperature and respiratory rate will be normal, but heart rate will become depressed. The onset is sudden. The animal will become blind all on a sudden. Orientation will be lost. Head may be elevated. They are not able to see, and the head will be elevated. Stargazing appearance like that. And excitement may be seen, but it's usually replaced with the dullness. Initially, there will be excitement, but then animal will become dull, and they may go down on its side with its head thrown back. The opisthotonous condition we have seen. We often call it as opisthotonous. The legs may be rigidly extended. Convulsion may occur, and if untreated, animal will die. In a normal feeding situation, we know that the rumen microbes generates the thiamine to meet the animal needs. We need not supplement. But some cases, what happens is that there's an enzyme called thiaminase that is produced by starch fermenting bacteria, and that will destroy this thiamine. And again, sometimes a thiamine analog produced within the rumen, sometimes that will cause some, instead of thiamine, that will intervene, and that will intervene the metabolic reactions in the brain, and that again causes deficiency. And another nutritional situation means excess sulfur intake from feed or water can produce clinical signs identical to thiamine deficiency. So what happens is there is no thiamine. There is no functional thiamine. So wherever thiamine is required for this, the cerebral functions, that is not there. So what happens? There is necrosis of the cerebral cortex. Neocortex will be showing degeneration and necrosis. That actually lead to the conditions of nervous signs, that is blindness, stargazing, opisthotonous, all those conditions. This is very typical. So when we see this, stargazing, and then elevated head and neck, and then the opisthotonous, this neck turned to one side. So it is very clear that the animal has to give, it needs some, urgent care. Treatment and prevention, it is large doses of thiamine. We can give intravenously or intramuscularly, it is advised. And later stages of the disease, but once that brain necrosis means it is severe necrosis, it is very difficult to recover the animal. And gradual adaptation of animals to initial grain feeding, that we have to take care. When we give a new, grain feeding, initial grain feeding, we have to give time. Gradual adaptation should be adopted. And if a case of PEM is diagnosed, if one animal is affected in a group of animals, then we should take care that go and inject all the remaining animals with the thiamine to prevent further loss. So we need to look for the clinical symptoms, and if one animal, if you can pinpoint with these symptoms, better go and treat other remaining animals with this injection. So vitamin A deficiency, it is again, it's sometimes when the animal is it's not having any access to greens. So especially in drought conditions. So the symptoms will be night blindness, corneal keratinization, pityriasis, then loss of weight, infertility. So all these that we know that, but see that sometimes congenital defects are common in the offspring of a deficient dam. So the dam is deficient, then the congenital deficiency also may be seen. The only thing we can improve this to avoid this condition is to have give access to green pasture. That alone is sufficient. Then copper and cobalt deficiency, it is characterized by anorexia and wasting. Growth and wool productions are severely retarded. These are again trace minerals, that is essential elements. Copper and cobalt required for many metabolic functions. They act as coenzymes. Growth and wool productions are severely affected. So may not cause death, but the production, or there will be economic loss for the farmers, and the wool may be tender or broken, and the fine wool becomes limp, and then the glossiness it loses, and the steely wool appearance will be there, and sometimes anemia, diarrhea, and thriftiness occur in extreme cases. You can very well treat this condition with the copper or cobalt sulfate treatment. The symptoms will disappear. But take care, copper is something that is a double-edged sword. It can also cause toxicity. So you should be very careful while giving copper, and don't give copper sulfate as such too much. And also you have to take care while treating these animals with the copper sulfate also. The animal may leak that, and that may cause copper toxicity. So that should be taken care of. Then calcium, phosphorus, and vitamin D, again, we have already seen some conditions that is because of the deficiency. See that animal requires calcium at a rate of 2.5 gram, phosphorus 1.5 gram, and the vitamin D around 300 to 500 units. And as we know, in other species of animals, the sheep and goat also, they are prone to rickets in kids and osteomalacia in adult. And you can very well control this condition by adequate supplementation in the feed. Then another important condition, that is iodine deficiency. That is something that is also that we have to look into, because it is something that is fatal sometimes, and many times newborns are affected severely. So iodine deficiency, when there is deficiency of iodine happens, it is much more affected in a particular geographical region, or when there is climatic differences. It's endemic. Other conditions like high rainfall area with iodine deficient soil, that means this iodine will be leached out. Areas with the coexisting selenium and vitamin D deficiency can also contribute. Geographical areas where there is feeds that contain goitrogenic substances, regions where goitrogens are fed in the diet, that is also some places it is popular. Then plants, sometimes when they are treated with the organochlore compounds, that also can cause this deficiency. And sometimes it can also happen as a genetic familial dysharmonogenic goiter, that is iodine deficiency, interrupting thyroid hormone synthesis. And the brassicas, the leaves are very familiar to us. So you should not feed these the animals with this much of these leaves, because it contains goitrogenic substances. So when we suspect a goiter in a flock of animal, this is very important, because sometimes there may be abortion. Abortion, we may not think of a deficiency of an element sometimes, because there are many infectious agents that can cause abortion. Bacterial and viral etiologies are there. So see that whenever you find abortion in a flock, you have to think of this fact of deficiency of iodine as well. Sometimes same flock, you will find premature birth of kids with enlargement in the neck region. That is very characteristic. Enlargement or in the neck region, that is seen in premature birth of kids. That means the aborted kids will the fetus will show this enlargement. And sometimes newborn lambs with nodular enlargement or gross enlargement in the neck can be seen. Newborn animals will be with the tule in the neck. And there will be loss of hair sometimes in the flock. Thick, flabby, edematous skin may be seen. And sometimes you may find in healthy animal, adult animal also, there will be large, firm, non-fluctuant. It's not moving, swelling of the ventral neck. So in the adult healthy animal. So in all these conditions, you have to suspect goiter or iodine deficiency. So whenever your animal is fed with these goitrogenic substances, brassica leaves or cabbage leaves, so you can see some pictures of nodular enlargement of the neck, ventral neck of this adult animal, as well as some fetuses, newborns. So all these indicate iodine deficiency. Premature kids with the goiter and baldness, that is exposed. This is from I have taken from the net, just to show you that the gravity of the situation. So you can see the enlarged thyroid gland. You see how enlarged it is. That itself can cause abortion. And the thyroid gland, it is something that we sometimes neglect. we don't give much importance for this gland, even though it is highly essential and highly important. It is located under upper ventral neck on the trachea. And it's not very big, but it has the whole iodine content. It has the highest concentration of iodine, 0.2 to 5% of the dry weight, and almost 70 to 80% of the total body iodine is in the thyroid gland. And normal iodine intake is 1 to 4 parts per million of dry matter. Just keep this in numbers. It's all depending upon the geographical area. So you have to please take care of these numbers. So drinking groundwater with iodine less than 2 microgram per liter, that can lead to iodine deficiency. What is seen is that the sandy oil that is generally deficient in the iodine. And inadequate iodine in the thyroid gland will lead to what, So we know that the synthesis of these hormones takes place in this gland, that is with the help of this iodine. And synthesis of uniodinated inactive pre-hormone instead of thyroxine. So the hormone is not produced, but something else is produced. Because it is uniodinated, not sufficient iodine is available. So what happens is that stimulates the pituitary gland to secrete thyroid stimulating hormone. The thyroxine is not there. The demand to meet the demand of thyroxine, the pituitary will give command to the thyroid through this TSH. And what will happen? The thyroid tissue that will show hypoplasia, and that will be seen as a considerable enlargement of the gland. That we call it as goiter. So we can treat this condition, or we can also prevent this condition. So we have to know that the dietary requirement is 0.8 milligram. It depends. Again, I'm not giving much stress to these integers because it all depends upon the locality and geographical importance and the sand of that particular area. But see that daily iodized salt requirement for goat, that is 4.5 gram for us. So once we start iodinized salt, that has greatly improved this condition. And you can give also oral supplementation with the potassium iodide, 130 milligrams of potassium iodide. And pregnant animals, to reduce this deficiency, you can apply tincture iodine on the back of the animal. And that also have shown some effect to reduce. 1 ml of tincture iodine you can apply on the back of the animal. That gives some result. And also you can give a drench as 28 grams of potassium iodide in 1 liter of distilled water. 10 ml drench can be given. So all attempts to be given to supplement iodine in the feed. Another important fact is that it is highly volatile, and what we have to do is we have to mix this iodine just before use. Otherwise, disintegrate. And you can also give iodized salt licks, but that also gives some problem because all the animals may not lick it uniformly, and some avoid leaks. So the best method is drenching. We can give potassium iodide drench. Condition can be prevented well by avoiding goitrogenic feed. There are many feeds and plants that contain goitrogenic materials like cassava, then soya-bean, then this, as I have mentioned, this brassicas. So many leaves and plants, they contain this goitrogenic items. So avoid that, especially during gestation. And we can give some iodine supplementation as iodized salt also. And this condition also have some similar other conditions. You may confuse with the bottle jaw, and sometimes when the lymph nodes are enlarged, GC gland abscess, and then sometimes salivary gland enlargement, sialonitis or sialolith. So all these conditions need to be ruled out. Lymph node enlargement, we can take an impression and see whether it's a lymphoma can be there. Bottle jaw, that means actually in deficient parasitism, we can find out this bottle jaw. And then GC gland, that is an infection. You can rule out the bacterial presence of bacteria, and then enlargement of the salivary gland also, that is easy to identify. So you have to give importance whenever you find enlarged nodular ventral neck in animals, and even adult animals, and also young newborn, and also when there is abortion in the flock. Please think of this particular iodine deficiency.